This presentation is a community analysis of Jacksonville, Florida, presented to you by Jordan Neustadt. In the objectives, I will describe the historical overview of Jacksonville, Florida, its community analysis with structure, population, health-related resources and availability, environment, government, and public policy, in addition to prioritized community needs and global community issue. Jacksonville was discovered in year 1513 by Ponce de Leon. In 1845, Florida officially became a state. There was a fire in 1901 that destroyed the city, but Jacksonville in all of its might recovered itself by 1912. Jacksonville developed into an up-and-coming downtown. Places like restaurants, parks, and views on the St. Johns River are just some of the establishments that came to surface. In the 1990s, the entertainment didn't stop with the build of a new NFL team called the Jacksonville Jaguars. Today, downtown Jacksonville and the Jaguars continue to serve the patrons of the city, with 868,031 residents reported in the 2015 census, and the city covering 885 square miles. Jacksonville has a population density of 980.8 people per square mile. Jacksonville, Florida is primarily composed of modest single-family type housing, with the majority of housing being apartment buildings and condominiums. During my windshield survey, I observed many of these communities to be newer with well-maintained landscaping and gated security. As in the surrounding communities, the housing options in Jacksonville adequately meet the needs of the community, which is flourishing with young professionals and families that continue to settle in Jacksonville after completing college at the universities in the Southeast. The Jacksonville Housing Authority offers public housing to families or the elderly based on an annual income not exceeding their guidelines. These homes owned by JHA, and they are spread throughout the city and the beach. In comparison to nearby cities, Jacksonville offers significantly more low-income housing options, especially compared to the nearby city, Ponte Vedra Beach, where you'll find very low-income housing options. While Jacksonville is meeting the needs of the low-income community, it is also drawing in a higher population of low-income families compared to nearby cities. Jacksonville has a strong highway infrastructure with several major interstates coming and going all directions, including I-95, I-295, and I-10. This allows residents and travelers easy access to other cities within Florida, such as Tampa, Orlando, and Miami, and it also provides easy access to other states in the Southeast, especially Georgia. Many of the highways are in good condition, free of potholes and debris, but there is still a lot of construction. Currently, there is construction on the I-95 highway within Jacksonville city limits. The construction causes extreme congestion, but this is inevitable for any city maintaining major highways. Compared to the surrounding rural cities and beaches, Jacksonville has the strongest highway access for residents, allowing several commute options. While Jacksonville's public transit system is better than its surrounding cities, it is extremely weak compared to other major cities with similar population levels. When looking at cities with similar population sizes, such as Austin, Texas, and San Francisco, California, it is clear how far behind Jacksonville is in this area. Jacksonville has a bus system offering called the Jacksonville Transportation Authority. It includes a bus, paratransit, Skyway, Game Day Express, the Beaches Trolley, and Riverside Avondale Night Trolley. The entire transportation system ranges from $0 to $2 per ride. JTA offers their route servicing all around Duval County. While the routes are there and the prices are low, the majority of residents find the transportation system inefficient and not worth the cost savings. Similar cities to Jacksonville have been more progressive, with metro rails and other more eco-friendly and efficient transportation that is used by higher class citizens for day-to-day transportation. Jacksonville has numerous taxi and other private driver services. According to the Yellow Pages, there are 30 taxi cab companies in Jacksonville. One of the most popular taxi companies is the Checker Cab. This company is known for transporting medical special need patients on a daily basis. They have 24-hour service at the Jacksonville International Airport. They can accommodate up to 12 people coming or returning from the Jacksonville airport. Being a metropolitan area, Jacksonville offers private transportation services such as Uber and Lyft, which are becoming more and more popular with other metropolitan cities. Lastly, the Department of Elder Affairs is a state-funded organization that provides free transportation for senior citizens and the elderly. Volunteers take the seniors to appointments, shopping, and help them plan meals and sometimes simply companionship. Jacksonville has several religious establishments that offer a place of community for residents and also serve the community with a variety of outreach programs to provide food, clothing, and support to those in need. A few establishments to note are Chet's Creek's Church, who in addition to worship gatherings, offer life groups, which are classes that help individuals grow in their faith while dealing with life's everyday problems. They also offer numerous outreach programs. St. Paul's Catholic Church offers several outreach programs in addition to Mass services, including Meals on Wheels, a thrift shop providing low-cost clothing and household items whose funds go to less fortunate in the community, and a mission house. The Church of 1122's mission is to move people to discover and strengthen their relationship with Jesus Christ. The members of the church can serve in the community, locally and internationally. Services are offered on Thursdays and Sundays at both locations throughout Jacksonville. 1122 offers many season services, such as food around the holidays and warm clothing and blankets during the year. Jacksonville is one of the youngest cities in Florida, with 42% of the population being between the ages of 25 and 54 years old. The most populated age range is 25 to 34 years old. This is reflective of the college graduates who begin their careers in the city after graduating from nearby universities such as the University of Florida, Florida State University, University of Georgia, and of course, University of North Florida. 59.4% of the population in Jacksonville are Caucasian, with the next leading race being African American at 30.7%. This is consistent with other cities across the southeast region of the United States. Jacksonville has not seen as much racial disrupt as other southern cities such as Charlotte, North Carolina, Charleston, South Carolina, and Jackson, Mississippi, but it has seen small bouts of riots around majorly covered racial issues. However, this hasn't been anything to bring a state of emergency to the city or the state. This is my main concern with the population because with the rising tension across the country and Jacksonville's racial makeup being similar to those cities that have had the most unrest, I worry that Jacksonville will be one of the next cities to have racial violence. This would affect health needs of the community, putting emergency rooms in high demand. Nearly half of Jacksonville's households are considered middle class, making $35,000 to $99,000 annually. The disruption of poverty and upper middle class are pretty evenly distributed at 28.7% and 23.7% respectively. This is expected and similar to most cities in the United States. This does, however, differ quite dramatically from nearby Ponte Vedra Beach, which is one of the wealthiest cities in the United States. This is a concern because with a more premier city right next to Jacksonville, it drives the younger population in Jacksonville to Ponte Vedra Beach once they're making enough money, greater than 35 years of age. So Jacksonville will struggle to increase its upper class. As is common across the United States, heart disease is the cause of death in Jacksonville. During my windshield survey, I did notice unhealthy behaviors such as alcohol consumption and cigarette smoking outside of restaurants and bars. There are also many fast food chains in Jacksonville that are nearly always busy. However, these behaviors are common nationwide, especially amongst the younger demographic that primarily makes up Jacksonville. The healthy behaviors that I have witnessed in Jacksonville are very positive. The climate and geography of Jacksonville provide a natural environment for residents to spend a lot of time outside. I constantly see people walking their dogs, running, biking, spending time at the beach, and enjoying the variety of activities available in Jacksonville. In my opinion, the active outdoor lifestyle that many practice in Jacksonville helps to lessen the effects of the unhealthy behaviors I noticed, so long as they are being done in moderation. The only concern I can raise with the healthy behaviors is risk of skin cancer as people are spending so much time outside in the sun. Jacksonville has a very large supply of community health services that certainly meet the needs of the community across downtown Jacksonville and the beaches. There are many express care options, such as CareSpot, who alone have 8 locations across Jacksonville. CareSpot offers convenience every day of the week for moderate pricing, and they accept most insurance plans. There are also 3 convenient urgent care centers across Jacksonville offered by Memorial Hospital. These centers offer 24-hour service, accept most insurance plans, and treat minor illnesses and injuries where residents may need immediate care but do not want or need to visit an emergency room. Jacksonville has many assisted living services and communities for senior citizens. 2 examples are Harbor Chase and Cypress Village. These communities offer a suite of services including independent living, memory care, and assisted living, and all have competitive amenities such as meal provision, medication administration, transportation, and communal gatherings. The pricing for these communities is not public as each case has different needs, but the community certainly has sufficient access to choose and they are highly accepted. I know many families who find the options available in Jacksonville to be an appreciated resource. They are available to provide top-of-the-line care for their older family members that is still nearby so they can remain closely involved in their lives. There are also in-home health care options available in Jacksonville, such as Brooks AmeriCare Home Health, who offer services in 23 counties in Northeast and Central Florida. Most insurances are accepted, and care is provided by a licensed physician. Services are offered to patients of any age. Behavioral health services are also offered across Jacksonville to help those suffering from mental illness or alcoholism and addiction. Services offered by Riverpoint Behavioral Health and Lakeview Health provide 24-hour care and accept most insurance plans. The social services available across Jacksonville include transportation for the elderly and disabled, a women's help center, and family children support. Baldwin Community Center and Dial a Ride offer free transportation to any elderly or disabled citizen in need Monday through Friday. This is very helpful for those who need assistance in accessing their health services. For families who need assistance during the work week, this is great so they don't have to take off additional time to get their loved ones to and from care. For individuals who have support themselves, this is great during the week, but they would have to search for other options during the weekend. There is only one women's help center in Jacksonville, and it is in a very low-income, high-crime part of town. With the size of Jacksonville, this is very inconvenient for many residents, and many of my female friends who I've spoken with don't even want to visit that part of town because of safety concerns. Of all health resources in Jacksonville, this is my main area of concern, as the services needed by many women are not very accessible or accepted. Lastly, the Florida Department of Children and Families offers many services to Jacksonville families and children for free. Services include an abuse hotline, adoption information, background screening, child care and welfare, legal services, domestic violence, homelessness, mental health support, and many more. The Healthy People 2020 Objective, HDS-7, for heart disease and stroke is to reduce the proportion of adults with high total blood cholesterol levels. Currently, 15% of adults over the age of 20 have had total blood cholesterol levels of 240 or greater. The target is to reduce this by 13.5%. I chose this objective for Jacksonville primarily because heart disease is the community's leading cause of death. Also, with the high level of fast food restaurants I've discussed, the community is more susceptible to higher cholesterol levels with such easy access to unhealthy foods. Additionally, according to the National Health and Nutrition Examination Survey, individuals who have only completed high school level of education have the highest cholesterol levels, and high school graduates are the most common education population level in Jacksonville at an astounding 29.3%. The objective C-8 for cancer is to reduce the melanoma cancer death rate. This makes sense as an objective for Jacksonville because not only is cancer the second leading cause of death, but with the level of outdoor activity and year-round warm, sunny weather, residents are at a higher risk to skin cancer, specifically melanoma. Additionally, Caucasians are consistently the most susceptible to melanoma and as mentioned earlier, that is over half the population of Jacksonville. The objective HRQOL-WB 1.1 aims to increase the proportion of adults who self-report good or better physical health. I've chosen this for Jacksonville because metropolitan cities struggle more in this area, and as Jacksonville continues to grow, this will continue to be a bigger problem if not addressed. With young professionals working long hours to kickstart their careers and access to unhealthy fast food chains and big bar scene at the beaches, Jacksonville has room to improve the overall physical health of its residents. In terms of sanitation resources, Jacksonville adequately meets the needs of the community with water supply and quality brought to residents by JEA, Community-Based Sewage Disposal, Jacksonville's Air Quality Branch, and the Wildlife Rescue Coalition serving the community. The two main concerns I found are the city's approach to solid hazardous waste disposal and recycling. Jacksonville's Hazardous Waste Division does not offer pickup services. Rather, residents must take the materials to the hazardous waste facility, and further it only is free for residents within Duval County. This inconvenience causes people to improperly dispose of hazardous waste materials. Based on my experience and discussions with other members of the community, Jacksonville lags behind other major cities when it comes to recycling. Many apartment condo buildings, which make up a large majority of Jacksonville housing, do not offer recycling services to residents. So those households typically do not recycle at all since the service is not conveniently available to them. There are also still many businesses who do not offer recycling services at work. So again, items people would normally recycle are being put in the trash because of inconvenience. Jacksonville's park and recreation offerings adequately meet the needs of the community, with dozens of free community parks, public beaches with several access points, dog parks, and sports parks. This is great for community health as it encourages outdoor activity across the city amongst all age groups and income levels. Jacksonville's law enforcement, fire and rescue, and disaster planning resources are all adequate for the community. Based on my experiences in Jacksonville and those of people I've interviewed, the emergency response efforts of Jacksonville are always timely and effective. There are enough resources to respond to the volume of needs, and the authorities are respected. In terms of disaster planning, the City of Jacksonville has a comprehensive emergency management plan that is well communicated with members of the community. I can speak from my experience during many hurricane and tropical storm threats that Jacksonville does a great job of keeping people up to date on developments through multiple media messages, and they also clearly communicate necessary actions to take in advance of the potential disasters. I find that during these threats, the community is very in tune to the messaging that the city is providing, and this is a good sign because it means that the people respect the message and necessary action seriously. After reviewing all of these environmental factors, I feel the main issue is with Jacksonville's environmental sustainability efforts. The lack of action being put towards hazardous waste disposal and recycling will only lead to long-term negative effects for the city's environmental health. Additionally, the trend in the U.S. to live sustainably continues to grow, especially among the young and affluent. So if Jacksonville continues to lag behind here, then it will struggle to attract ideal residents to the city. Lenny Curry is the 44th mayor of Jacksonville, elected in 2015 for a 2-year term. He works closely with the City Council to ensure appropriate actions are being taken to sustain and improve the city's safety and well-being. The City Council is made up of 19 members who all serve a 4-year term, with the President and Vice President being elected annually. All of these community officials, including the mayor, are very active and accessible in the community. Lenny Curry makes an effort to attend many events hosted by various organizations within Jacksonville. For example, he's involved with Generation W, an event held in Jacksonville each year to connect and inspire women in business, and he attends the event as a guest speaker each year. I've prioritized the top 6 community needs to be: number 1, revitalizing low-income, high-crime neighborhoods; number 2, public transportation; number 3, heart disease; number 4, environmental sustainability; Number 5, more support services for women. And number 6, expand the community health. I've prioritized these in order based on the needs I feel can see the quickest results if addressed. We'll discuss each slide in further detail in the following slides. Community need number 1, revitalize low-income, high-crime neighborhoods. There are many neighborhoods in the north side of Jacksonville that are very old, have low-income households, and are home to the majority of the city's crime. Jacksonville should investigate how it can, number 1, improve safety in the neighborhood's current state, number 2, allocate resources to revitalize the environment of those areas, and number 3, changes it can make to the neighborhoods to entice a different demographic to settle in the area. Community need number 2, enhancing public transportation options. While Jacksonville's highway infrastructure is a positive feature of the city, the lack of public transportation efficiency and acceptance has many drivers on the road, leading to many accidents and higher pollution levels. Jacksonville needs to incorporate more advanced public transit options that entice community professionals to utilize the system. Currently, the systems are mainly used by low-income individuals without a vehicle. Community need number 3, improving heart health. Heart disease is the leading cause of death in Jacksonville. While this is common across the United States, Jacksonville's robust fast food scene entices residents to have more unhealthy consumption habits. Community need number 4, improving environmental sustainability efforts. As a major city, Jacksonville lags far behind similar cities in the United States in terms of environmental sustainability. The city's hazardous waste disposal and recycling services make it inconvenient for the majority of communities in Jacksonville to effectively dispose of relevant materials, so residents are improperly disposing of their items. Additionally, as mentioned earlier, Jacksonville will fail to attract new, young, and affluent members to the community, as this continues to be a more popular trend and value of these demographic categories. Community need number 5, more support services for women. Despite a few support services offered in Jacksonville, the city could always use additional women's centers, counseling centers, and domestic violence centers. Domestic violence is becoming an epidemic in the city, which is why additional services are needed. Lastly, community need number 6, expanding the community health. With an increased amount of health disparities occurring in Jacksonville, much needs to be done in order to combat these health issues. Jacksonville offers several hospitals and clinics, but additional education will help prevent further health disparities. With growing concern of global warming, environmental sustainability is a global issue that nearly all countries are aiming to improve. While Jacksonville has some efforts in place, it is far behind other major cities in the United States and worldwide. It's typical for only housing neighborhoods to offer recycling services, but in many multi-unit complexes, only trash services are offered. This leads those residents to not recycle at all because of convenience. Further, recycling bins offered the city are not as common to find. It is typically only trash cans. Scandinavia ranks as one of the most environmentally conscious regions in the world, with all 4 countries, Sweden, Denmark, Norway, and Finland, ranking in the top 10. They've been successful in this realm because of their partners with local businesses. When gathering influential business in on the goals, they have been able to shift business projects to put environmental safety at the top. They also engage their local business to provide services in their offices that make things such as recycling easy for the employees. In Sweden, less than 1% of Sweden's household waste end up in the trash dump. In Sweden, it is countrywide law for recycling stations to be no more than 300 meters away from any residential area. This is the end of the presentation.